going today?
I'm all right.
You're all right. Well, my name is Shay. I'm going to be your nurse today. I'm just here to do some assessments since you are 14 hours post-op. Is that all right?
Of course.
Wonderful. I'm just going to raise your bed up here. And do you mind if I raise up the head of your bed as well?
Oh, yes, please.
Thank you. Perfect. I'm checking the bed breaks there. And as the bed was raising up, I'm checking the IV bags here, making sure that there's no kinks at all. Perfect. Making sure that we have IV fluids and it's the correct fluid, nothing's expired, and it is for our patient here. Okay, do you mind if I check your wristband?
Of course.
Thank you. And could you tell me your name and your birthday?
Anna Perry, November 23rd, 1943.
Wonderful. And at the same time, I'm also checking your IV site, making sure it's not swollen, there's no redness to it, and the IV is still intact in there. Do you mind if I touch your hand here? Perfect. I'm just checking her skin turgor as well as her cap refill here. Okay, perfect. And I'm just going to go over to the other side here. So with that check, I've now already done her ABCs because she was able to answer all my questions. So I know that her airway's open, she's breathing normally, and her hand was also warm, and I'm looking at her face and her skin color is pink as well. So could you tell me where you are right now, Anna? I know it's a silly question.
I'm in the hospital.
You are, and could you tell me what month it is?
It is February.
Perfect. And so I'm just going to do a set of her vitals. I would be putting a blood pressure cuff on her, taking her respiration rates, doing her temperature, as well as her O2 saturation. I'm just going to listen to her apical pulse. And for that, make sure I sanitize the bell. Just lifting up your shirt here, Anna. And I'd be listening to that for a full minute. Perfect. And I also want to get on your pain level and make sure you're not in any pain at all, Anna. Are you in any pain? You in any pain?
Kinda.
Yeah, kinda. And could you tell me where the pain is?
It's to my incision site.
To your incision site. Okay. And does it hurt all the time or just when you're sitting or standing?
Oh, all the time.
All the time? Okay. Could you describe what the pain feels like?
It's a really heavy ache.
Okay. I'm just going to roll the dice here so that we can determine what your pain level is. So you're at a 9. So I for sure want to get on top of that pain control there. I'm going to give you 1,000 milligrams of PO acetaminophen right away. And I'm also going to give you 0.7 milligrams of IV Hydromorph. I'm going to be taking your respiration rates before I do that, because if they're less than 12, I know that we hold that. And yeah, we take your respiration rates today, so that's not something that we have to worry about. So I do want to auscultate your lungs. So I'm going to get my handy dandy assistant over here to come help me do that. I'm going to lower this bed so that you can sit on it with her. I'm sure it's okay. Just do with her. Perfect. And my bell has already been sanitized. So take a deep breath on your discretion. Every time I move the bell, I'm going to ask you to take a deep breath. If you're not able to, feel free to wait a sec and do it whenever you feel like you can, okay? Raise this up a little bit before I get started. Okay on it? Keep those proper body mechanics. Okay, let's start. Whenever you can take a break if it's too much right now. Perfect. And then I'm going to go to your back side here. Feel free to just stay up there. Okay, go ahead. And again, whenever you can. Okay. Thank you, patient.
Thank you.
Perfect. And then I also want to be auscultating my patient's stomach. I want to do a full stomach inspection. So before I start that, I do want to ask if they've had a lot of gas at all since their surgery. So have you had any gas at all, Anna?
I have, yeah.
You have, that's a good sign. And have you been able to go pee in the last little bit?
Yeah, I went a little while ago.
Okay, perfect. I'm just going to be assessing your stomach and I don't want to be poking around in case you have a full bladder there, okay?
Thank you.
Thank you. So is it okay if I lift this up?
Of course.
Thank you. So right away, I'm just inspecting the stomach and seeing if there's any rashes, any redness, any big bulges, and everything's looking good there to me. And so now I'm gonna listen to all 4 quadrants here. Perfect, and I am hearing hypoactive bowel sounds, which is good as long as I'm not hearing absent. And I am going to palpate a little bit just to see if the abdomen is nice and firm. Perfect, and we're all good there. Thank you, all over this now. Okay, and now I'm going to be going on the other side to get some gloves. Sanitize my hands here. So I'm just going to be assessing Anna's incision site as well as her drain. These gloves first. Okay, and I'm just wearing gloves in case for any reason their incision was leaking. I don't want to get any body fluids on my hands, as well as that pump, if it were, or that drain, sorry, if it was leaking or anything. I want to make sure I'm getting any body fluids on my hands. So is it okay if I lift this up here? Thank you. So I'm not changing the dressing, I'm just looking at the incision site and making sure it's dry and intact. I can feel it here and make sure that there's no blood seeping through there at all. And then when I'm checking the drain here, I see that the suction is on, and I'm going to release the suction just so that I can look and see at the amount of fluid I have here. And I have about 20 cc's of fluid there, so I'm going to reactivate that suction. Reactivate that suction and make sure that that suction stayed in place. Perfect. Okay, so now that that's all done, cover that back up and discard of my gloves. And then I'm going to be checking out their feet. So when I check out their feet, I'm just going to lift up this blanket here, Anna. So right off the bat, I want to check their pedal pulses. I'm going to do that at the same time just to make sure they're equal. Perfect, so I feel both pedal pulses there. And I also just want to do this a little bit on the legs just to make sure that there's no DVTs, feeling for hot spots, all that sort of stuff. Perfect. And then I'm going to go ahead with some sensation tests. So I want to see if they have full sensation back in their feet. So I'm going to grab a tongue depressor. And now rip it in half. Using one side for dull, one side for sharp. And I'm hoping that Anna feels this right away, because she is forced to 14 hours post-op. Okay. Oh, you felt that. Perfect. And
Oh, I felt that.
oh, perfect. Okay,
Ow.
just making sure still.
Oh yeah, yeah.
Yeah. Okay.
I feel that.
Felt that there?
Yes.
Perfect. Okay, and I'm just gonna get you to do a couple exercises with me with your feet. If you don't mind pointing your toes towards me like a ballerina.
Okay.
Perfect, and then towards yourself. Flex them.
All right.
Perfect, and do that with both feet. Wonderful. And then I am just gonna do a couple more checks on you. I'm just gonna see if you feel this here. Oh, perfect. And this here.
Yep. Uh-huh. I feel that on my heel and my hollow of my foot.
And here.
Feel that between my toes.
Wonderful.
On the side of my heel.
We also are going to be checking the color of their feet, making sure that their feet are warm, and I also want to check their cap refill, which I would probably have gloves on for in this instance. Just checking their cap refill. Perfect. And that's good there. Okay, awesome. So I'm going to go ahead and cover her back up, and I'm going to do some patient teachings with you, if that's all right. So there are a few things that we do need to keep in mind since you are 14 hours post-op. We want to make sure that you're still doing those deep breathing and coughing exercises. Is it okay if I go over that with you? Perfect. So when you're deep breathing, I want you to be breathing in through your nose, holding that for about 3 to 5 seconds, and then breathing out through your mouth with pursed lip breathing, sticking your lips out like a little duck. And you're going to be wanting to take about 3 or 4 breaths every time you do that, doing as much as you can within the hour, about 10 times if you can. So I'm going to be teaching you some other things as well. I just want to make sure you understand and I'm not overwhelming you with information. So did that make sense on how to deep breathe?
It did, yeah.
Yeah. So how could you explain to me how we're going to do that?
I am going to breathe in through my nose, hold for 3 to 5 seconds, and breathe out through my mouth as if there's a straw in my mouth.
Perfect.
10 times every hour.
That's perfect. And if you can, after those breaths, if you feel like you have some secretions in your throat, feel free to cough and get those secretions out. That'll be really helpful.
Okay.
And I'm also going to teach you a little bit about the spirometer, which I know that they already taught you a little bit about, but is that okay if I go over it?
Of course. I don't remember what it is.
Okay. Yeah, so it's this funky little tool here. So how we use this is we're going to take a deep breath out. We're going to put this to our lips, and we're going to take a deep breath in and keep breathing in until this yellow ball is right in the middle at that happy face there. And we want to keep that ball at this happy face for about 3 seconds if we can. And then once we've done that, we can go ahead and take this tube off of our mouths and breathe out again privately. Does that make sense?
It does. It does. I'm going to breathe out all the way.
Yep.
And then breathe in so that the little ball stays at the happy face for at least 3 seconds.
Exactly. Perfect. Thank you so much. And then there are 2 other small things I want to go over with you before I leave. I hope I'm not overloading your brain too much. So you do have full sensation back, but we do still want you to be careful when you are getting up and walking. Standing up, we want to make sure that you are doing it slowly, dangling over the bed for a little bit to prevent orthostatic hypertension. You do have a commode and a walker at your bedside. We want to make sure that you're using those. Still asking for assistance when you do get up would be a great idea, and we do want you to keep doing those exercises that your physical therapist prescribed to you. He has some for both your non-affected and affected leg, so make sure you're doing those. You remember those?
Yeah.
Perfect.
Yeah. I'm gonna wiggle my toes on my surgical side.
Exactly, exactly. And lift up your leg on that other side. Wonderful. And I do want to go over one last thing with you, signs and symptoms of infection of your wound. So just if you're noticing any foul smells, a lot of redness or pus or swelling, or if you're in a lot of pain or have an increased fever at all, just let us know for sure. We just want to make sure that you're not getting infected whatsoever and keeping an eye on that, okay?
Okay, sounds good.
Perfect. Do you have any other questions for me before I leave today, Anna?
When's breakfast?
Breakfast is soon. We'll make sure we get it in as soon as I get out of here, okay?
Thank you.
Okay. Thank you so much. I'm going to make sure your call bell's there, and we're good.